I've been using Ambient AI Scribes for over a year now. In that time, I've tested, advised on, or gone hands-on with at least 10 different platforms. Dax, Iscribe, Doximity, Vodamed, Open Evidence Visits, and a few others you've probably seen demoed at different conferences. I've seen it all: wild hallucinations, completely made up physical exam findings, but I've also seen busy clinicians getting their valuable time back. What I've learned is that there's a massive gap between what these tools can do and what most of us are actually getting out of them. So today, I'm giving you 15 things I've picked up in a practical, quick tips format. These tips and tricks are sourced from peer-reviewed papers, from colleagues across different specialties, and from my own clinic. I'm going to do my best to stay general so that you can get the most out of whatever Ambient Scribe product you're using. And yeah, if you're watching this and you don't use an AI Scribe yet, or if you've tried it and thought, this isn't for me, stick around. By the end, you'll know whether it's worth the switch. So let's go. Hi guys, welcome back to the channel. I'm Dr. AJ Valaram. I'm a full-time physician and surgeon, and this channel, SpeakMD, is where I break down medical technology from the perspective of hardworking medical professionals. For disclosure, I'll be using examples from a bunch of different AI scribes today as visual aids. I have advised for some of these products, but this is not a sponsored video. So Ambient Scribes are everywhere right now. The Permanente Medical Group alone just rolled it out to 10,000 physicians recently. 1 in 3 medical practices are using and implementing the technology. So that's not really a pilot anymore. That's a platform shift. But the research is also pretty clear on something else. These tools hallucinate. They miss things. They can drop a symptom the patient never mentioned or invent an exam finding that you never did. And you're the one signing off on the note. So if you're going to use one, you might as well use it like you mean it. Here are the 15 tips. Tip number 1, map it to your phone's action button. Okay, small one first. The worst thing is finishing a 30-minute patient encounter and then realizing that you didn't have the Ambient Scribe on the entire time. Every major Scribe app now publishes an iOS shortcut. You can wire the Ambient Scribe to the action button on your phone. If you use an Android phone, you can customize the power button to double tap it to open this specific app. So then it's just one press, recording starts, walk into the room, and one less thing to think about. Set it up once, thank yourself for the next year. Tip number 2, figure out your consent. So this one, of course, isn't optional. Most major health systems require consent before recording a patient encounter. An office handout or a framed flyer in the patient room can work too, but check that with your legal services. And if you're practicing in a 2-party consent state, California, Florida, a handful of others, it's legally required to verbally ask permission before each and every individual patient encounter. Some scribes document the consent for you, or you can say a dot phrase to drop it into your note. So 1 sentence to the patient, 1 dot phrase in the chart, and you're covered. Honestly, after using these products for over a year and gaining consent from my patients don't really care. They just want you looking at them instead of constantly looking at the computer screen. Tip number 3, nail your microphone setup. So this is the single biggest thing that nobody really talks about. Your scribe is only as good as what it hears. So I've always used my personal cell phone as the Ambient Scribe mic, and it works in just about every situation. Now, I know some of you aren't cool with using your personal device, but if you're using an iPad or an employer-provided device, it's the same concept. Sometimes I'll have the phone in the top pocket of my white coat. Sometimes I have it on the computer desk between me and the patient. It's important that the patient can be heard and I can be heard, and so the placement of your device is going to be important. I try to avoid any extraneous noises. A lot of times I'll close the door if it's a loud hallway, and you want to keep the microphone about 1 to 2 feet between you and whoever you're talking to. I personally am not a fan of having a stationary device that sits in a clinic room because, as you'll see from the tips and tricks coming up, recording in and out of the room helps the system work better. That's why something that's always with you, i.e. your phone, becomes a really good option. Tip number 4, stop talking over your patients. This one's embarrassing but true. Speaker diarization. That's the AI figuring out who said what. That all falls apart the second people start talking over each other. And a lot of us, myself included, we interrupt, we finish sentences, we move fast. Let them finish, then you talk. So this becomes another positive from a patient standpoint. Their doctor is not constantly interrupting them. Not because we have all the time in the world, but also because that'll contribute to the Ambient scribe working the best that it can. Tip number 5, chart review out loud in the hallway. We always complain how time requirements for billing don't take into consideration work done away from the patient. You don't get paid per se for pre-charting. Now you can use that chart review time to fill out your note. Before you walk into the room, hit record, 30 seconds, just talk. Preface for the note: 38-year-old male, history of diabetes, COPD, hypertension, hospitalized in July for pneumonia. Here today for his post-op follow-up. He is 6 weeks out. That's it. You just saved yourself 5 minutes of typing past medical history. The AI folds it right into the HPI when you walk in. The better scribes will allow you to dictate completely out of order, and then it will reorder your information so the note is appropriate. I'm an orthopod, and we always joke that our H&P is looking at the x-ray. We can often gain a diagnosis just from reviewing the x-ray and the patient's age. So often, I'll dictate my read of the x-ray before I go in to see the patient, then finish the dictation after the encounter. But if you're a medical doctor and you're doing lab review or reviewing a consultant's note, you can absolutely speak that into your scribe in a pre-patient setting. This has the added bonus of not walking into a patient's room cold, but actually being fully aware of what happened in their previous visit. So I started doing this on the walk down the hall, and now the hallways are some of my most productive minutes of the day. Tip number 6, stop over-narrating in the room. So this is the one. If you take nothing from this video, take this one. You do not need to say abdomen soft, lungs cleared auscultation, lymph nodes tender out loud while the patient is lying there staring at you. It's weird, it's robotic, and frankly, it makes the patient feel more like a data point. Instead, talk to them like a human, then after they leave, dictate the physical exam. Hang on, we'll get to that one in just 1 minute. But let's step to number 7. Now, the opposite. Do verbalize the assessment and plan out loud to the patient. So now we've kind of flipped to the opposite. This is something you want to do in front of the patient. At the end of every visit, recap the plan out loud, not to the chart, to the patient. So to recap, I think the shoulder pain is likely rotator cuff tendonitis. We're gonna get an MRI, we're gonna start you on an anti-inflammatory medication, and I'll see you back in 6 weeks. So 2 things just happened. 1, the patient leaves with total clarity on the plan, which is the #1 driver of patient satisfaction scores. 2, you just handed your AI scribe a perfectly structured assessment and plan section. No cleanup needed. Tip number 8, dictate the exam as an addendum after you leave the room. So the patient's done, doors closed. Now that's when you dictate the exam. Instead of dictating those physical exam findings awkwardly while you're examining the patient, you can do this after you've left the room in a quick and easy format, and the AI will recognize it's the physical exam and put it in the physical exam section. So 30 seconds, every technical detail the AI couldn't see is now in the note. Clean, organized, no awkward robot talk in front of the patient. The underlying concept of how to use your Ambient scribe throughout the encounter, both before, during, and after the patient visit for a more comprehensive note, comes from an excellent article by Dr. Christian Peen. Please read his article and check out his Substack. I've linked to it down below in the comments. Tip number 9, coach the AI like a junior resident. This is the part that most of the physicians miss. You can talk to these things. Seriously, modern scribes, they follow natural language instructions. So at the end of your dictation, just say it. Emphasize that the neuro exam was completely normal. Add a line that we provided 2-day work excuse. Make the assessment more concise. So the Ambient Scribe will listen, it will adjust. Treat it like a smart scribe that can learn your actual style, because functionally that's what it is. So this is a big deal. If your Ambient Scribe continues to make the same mistake over and over again, it can be really frustrating. Try to finish that portion of your note and then dictate, hey, make sure you put all those positives and negatives in the physical exam. Don't summarize it. It'll do it for you, it'll listen to you, and it'll make those changes. Tip number 10, use the structuring keywords the model is trained on. Words matter. Certain trigger words like plan, diagnose, order, follow-up, allergy, treatment, these get routed by the AI to the correct section of the note automatically. So when you say, my plan is to start lisinopril 10 milligrams once daily for 30 days, the AI knows that's the plan section, not the HPI, not the review of systems. Now, some of you are saying, that's not my normal language when I'm talking to a patient, and I completely understand that. But if you can make these small little adjustments by using the right word here and there, that could save you a ton of time when it comes to after-hours charting. When you realize how much time it can potentially save you, you'll start throwing these words in and it'll start becoming natural in your patient encounter. Small linguistic hack, massive downstream payoff. Tip number 11, customize your template. Don't settle for the default. So nearly every platform lets you set up a custom prompt for how the note is formatted. And if your platform doesn't have this yet, they're desperately trying to implement it so that they can compete with the other platforms out there. So you can customize things like, in my note, I like to use full sentences versus bullet points, keep it formal versus casual, and group the assessment by problem. Make sure you omit trivial negatives from the review of systems. If you can add these things into your prompt, your AI will know that's the way you like your note, and it will make every note going forward from there in that manner. If you're accepting the default output, you're doing edits on every single note you sign. So spend 15 minutes one time, dial in your template. That 15 minutes gives you back hours every week. Tip number 12, go hybrid. Keep your dot phrases. Okay, you've been seeing patients the same way for years, if not decades. You don't have to throw out years of muscle memory. I still occasionally will use my dot phrases. I still use my smart templates on occasion. Sometimes I want specific language in the note, say for medical legal reasons or compliance, and I'll use those dot phrases and templates at the end of the day just to put that information in. It's okay to add that along with your Ambient Scribe note. Sometimes I'll just dictate into the AI like a dictaphone. I have colleagues that don't bring the phone into the patient encounter at all. They just simply use the AI to dictate like a dictaphone, and it saves them a ton of time because it takes all that information, formats it correctly, puts it into the right section of their note, and it'll save them 100 clicks at the end of the day. Also, you can use most ambient AI to verbally drop a dot phase, dot exam heart, where the AI drops your template in. So Kaiser, when they looked at this, actually found this was the single biggest unlock for physicians who were template loyal. You don't have to choose. Layer them. Tip number 13, verbalize nonverbal findings. The AI can't see. Remember that. If the patient looks anxious, if there's a visible rash, if there's a grimace when you palpate the abdomen, if they're tearful, you have to say it, either in the room or right after. I note the rash on the left forearm is erythematous, roughly 2 centimeters, well circumscribed. If you don't say it, it doesn't exist. That's the whole game. Tip number 14, pause the scribe for sensitive topics. So mental health, domestic violence, substance use, sexual history. These are moments where a patient may hold back if they know a recording is running. So JAMA's guidance on this is pretty explicit. Pause the scribe. You can always document those sections manually afterwards. The trust in the room is worth more than the time saved. I had a patient last month who literally asked, "Is that thing still recording?" before she told me something important. That's when I knew that this tip mattered. Tip number 15, never ever sign without reviewing. I'm putting this last on purpose because it's the one that could get you in some trouble. The AI will on occasion hallucinate. It's documented in all of the peer-reviewed studies that have reviewed ambient AI scribes. The most common pattern, inserting normal exam findings that were never discussed. Lungs cleared auscultation, abdomen soft, no acute distress. If you didn't examine the abdomen and the AI drops abdomen soft in your note, that's your signature on a fabricated exam finding. So 30 seconds to review the note at the end, that's all it takes. Scan the note, checks for hallucinations, check for omissions. And I know this sounds like double work, but remember the AI is learning from the corrections that you make. It will get better with software updates and time. It will continue to learn how you want your note. What I've been really surprised with is how much it picks up when I read these notes after clinic. Stuff that's important, but I wouldn't have remembered to include that in the note if I was doing my notes at night or the day after. The AI Scribe is a tool. It's not a replacement for physicians, and that's a good thing. So here's the honest take. These tools are getting legitimately good. The burnout data is real. 52% down to 39% in 30 days across 263 clinicians. That's not marketing, that's a peer-reviewed journal study. But the tools only work if you work with them. The physicians getting the full hour back a day are the ones doing these 15 things we just talked about, not the ones just pressing record and hoping. And look, the doctor who just presses record and is not impressed with the output, I've been that doctor. We've all been that doctor. It's fine. Just don't stay that doctor. If this was useful, hit subscribe. Next up on the channel, I'm breaking down SRTH, the autonomous surgical robot out of Johns Hopkins. It's wild. You're going to want to see it. You can check that out here. Or follow up with this video on open evidence. Until then, I know your time is valuable. Thank you so much for watching. Have a great day.